The history of plastic surgery long precedes the development of the Western world, and examples of plastic surgery can be found in ancient cultures all over, including the Indian subcontinent. Multiple centers for plastic surgery have developed outside of the United States and Western Europe more recently, and one such example is South Korea. I'd like to refer you to the associated blog post that has much more information than what I'll be discussing today. And I also like to refer to a few sources that are the source of information for what we'll be discussing. The first is a book by DeMoya entitled Reconstructing Bodies, Biomedicine, Health, and Nation Building in South Korea Since 1945, published in 2013. Another book by a last name Hugh titled Flawless, Lessons in Looks and Culture from the K-Beauty Capital, published in 2023. An article within a larger book published by a last name Lee titled Beauty Between Empires, Global Feminisms, Plastic Surgery, and the Trouble with Self-Esteem in the book Fashion and Beauty in the Time of Asia, published in 2019. And an article by a last name Marks titled About Face, Why is South Korea the World's Plastic Surgery Capital, published in the New Yorker in 2015. Commonly referred to as the Republic of South Korea, South Korea has the highest per capita rate of surgery and the highest per capita number of plastic surgeons in the world. The patients who undergo plastic surgery in South Korea also tend to skew a little younger. For example, in 2015, it was found that approximately 1/3 of women between the ages of 19 and 29 reported having undergone aesthetic plastic surgery procedures. Now, it's actually common in South Korea to receive a gift card upon high school graduation for plastic surgery procedures for both men and women. The three most popular procedures in South Korea include the double eyelid surgery or blepharoplasty procedure, rhinoplasty or nose surgery, and V-line surgery. V-line surgery is the narrowing of the jawline to a sharp taper at the chin, and this is a very popular procedure for both men and women. The origin story for plastic surgery in South Korea is typically attributed to an American surgeon, David Ralph Millard. He was the surgeon for the United States Marine Corps during the Korean War, and he remained in South Korea after the armistice. He is widely considered the individual who popularized plastic surgery in South Korea, and some even attributed the development of double eyelid surgery or blepharoplasty surgery to him. They felt the technique was meant to quote-unquote westernize the face so that South Koreans would better approximate the Americans who they had met and worked with during the Korean War. However, this is not true. In fact, double eyelid surgery was invented by a Japanese plastic surgeon in the late 1800s. Furthermore, Korean surgeons more often referenced techniques developed by individuals in South and East Asia much more often than Western surgeons when they were discussing their techniques. The purpose of double eyelid surgery, for example, was not to westernize South Korean eyes, but actually reflected the local and regional preferences, the aesthetic preferences at the time. The field was professionalized in South Korea with the foundation of the Department of Plastic Surgery at Yonsei University in 1961, and the subspecialty of plastic surgery was officially recognized in 1973. Plastic surgeons began to focus more on cosmetic plastic surgery starting in about the 1980s and 1990s after healthcare reforms largely nationalized the healthcare system. These plastic surgeons moved to most cases the Gangnam district of Seoul, and this area is now known as the Beverly Hills of Seoul. Another impetus for the development of plastic surgery in South Korea was the fact that the government supported the exportation of cosmetic plastic surgery abroad, and Hallyu, or South Korean popular culture more broadly after the Asian financial crisis of the late 1990s. And the popularity of cosmetic plastic surgery in South Korea by the Koreans themselves, as well as the many medical tourists who come, is such that there are many procedures that are offered in South Korea that are not currently offered in the United States. And there are many cosmetic products, including skincare products, that are offered in South Korea that are not offered in the United States. So a great deal of innovation has occurred in that country.